Now, we asked you on our Fox 61 Facebook page what you would want to ask doctors about the coronavirus.
And here now with the answers is Dr. David Banach. Dr. Banach, thanks for joining us again. We appreciate it when you come in. First question, and we've talked about this, and a lot of people are talking about this. Cindy says, I am supposed to travel to London in 3 weeks. Should I reschedule? I worry about the planes and the germs.
So I think that's an important question. Travel is something that comes up all the time. And I think as far as what to expect, it can be a little difficult to predict what's going to happen throughout the world. So I think the most important thing to do is to check the CDC website. They really update their guidance frequently regarding any travel restrictions or concerns to know which countries are particularly concerning. So I think really that's really the go-to site that I always tell patients to go to if there's any questions about travel.
Melissa asks this next question. She wants to know, if the coronavirus spreads to Connecticut, what do I need to make sure I have in my house? How should I be prepared?
So I think, as I've been spoken before, really things to do to prevent yourself from becoming infected is really focusing on basic infection prevention measures. So washing your hands frequently, staying away from sick people. In terms of what to prepare, I think the most important thing is to really have some preparations into what you would do if perhaps you're not able to go to work. Are there opportunities to telecommute? There's even discussions about schools, how to help with schools if they do end up becoming closed. So just having some planning in mind as far as like actual things to bring home to have in your house. Not a lot of restrictions or a lot of specific recommendations. Really having materials to just have your day-to-day activities and operate your life, I think, would be the key things. But just being really attentive to any special plans that might need to be made.
Once again, another one that we have talked about before, but it bears repeating. Patty wants to know if this is being spread through delivery, and she's asking, should we look carefully on food packages to see if they're from China? So
that's another common question that we get. I think there's no evidence at this point to suggest that the virus can live on inanimate surfaces for long periods of time. So I really don't foresee that being a risk as far as a virus being on a package that's sent from China. So I think that's not really something that we need to be focused on at this point.
According to the CDC, there have been at least 45 million cases of the flu in the United States this season, and there have also been thousands of deaths. That includes 58 here in Connecticut. So Gregory wants to know, should we be more concerned about the flu?
So I think at this point, the risk to anyone in this area of getting the flu is certainly higher than to get infected with coronavirus. So I think in terms of perspective, that's really important. The other piece to think about is in terms of ways that we can protect ourselves from the flu, there's a lot of overlap between the ways that we protect ourselves from coronavirus infection. So the same basic infection prevention measures. Of course, there's also a vaccine for the flu, which I think is a really important point. So we still give out flu vaccines, and I would encourage anyone who hasn't been vaccinated to really take advantage of that as a way to protect themselves.
All right, Dr. Banach, thank you. You can expect more continuing coverage of the coronavirus outbreak. For the latest details, you can